Hello, my name is Justine Calnan, and today I'm going to be talking to you about informatics and the ways that it's advancing the field of nursing. Let's get started. So, to begin with, let's talk about what informatics is. This is a definition provided by the American Nurse Association, and I'll let you go ahead and take a look at that. But the main things you should know is informatics is a field looking to use computer science and technology to advance patient safety and care within our hospitals and clinical settings. There's also some work in informatics to help advance the field of nursing education. Um, Informatics has been around for a long time, but we have gone through several evolutions. So let's talk a bit about the beginnings. At the very start, we had nurses who sought to gather data and use that to adjust treatment. They didn't have any technology. This is way back in the time of like Florence Nightingale. Towards the 1950s, Harriet Worley took the opportunity to speak with IBM and see what potential benefits there could be to using computers in healthcare. As they became more readily available, nurses began integrating them into their work, and around 1989, informatics was defined. From there, they were not recognized as a specialty until around 1992. And it took quite a while for their scope and standards to be defined. It wasn't until 2001 that the American Nurse Association took the previously defined scope and standards and put them together in something that could be used to guide practice. Around 2004, the president pushes to increase the use of electronic health records, which kind of brought us around to where we are today. Um, Finally, in 2015, again, those standards were looked at and they were kind of changed to go with new technology. So, what are we seeing informatics in today? Commonly, we are seeing electronic health records. We're also seeing a lot of information sharing and tools that are used to increase safety. Electronic health records started as just a way to keep these programs and all the documents together rather than going and finding a paper chart, which was easy to destroy and could only be kept in one place at a time. We were putting these online and basically giving providers an easier access and an easier way to review information. From there, we started to see a lot more information sharing. Facilities that have the same type of records could take this information and use it to review what was going on at their facility. And then we got introduced to programs like Epic that integrate tools to help us keep our patients safe. Some of these tools include medication scanning to prevent errors or scanning of blood products to make sure that the right blood is being given. We're also now seeing a lot of advisories in patients' charts when we're documenting vital signs that may be consistent with sepsis or patients who are pregnant and at risk for preeclampsia. So there's a lot of really good applications we see today. As a nurse leader, there is several critical roles that are filled in the field of informatics. First and foremost, they can advocate for new equipment and technology as they kind of identify the needs of their practice. That being said, any new software puts our patients at a risk for data breaches, and so they need to ensure that we're using things that are compliant with federal regulations while also ensuring that we are doing what we can to protect our patients. With any change, nurse leaders are kind of the driving force to ensure that technology and anything else is successfully adopted. And so they're going to be overseeing staff education. They're going to be rounding with staff and making sure they understand why we're using these things and how they can help us. After this technology is in place, they can use this information that's being gathered to identify potential practice gaps and areas that we could use improvement on. A place I see this commonly is my nursing leadership taking our daily informatics or our daily information and using that to help guide us so we can tell if we are transferring a greater number of patients or if we are seeing a lot more patients leave without being seen in the emergency department. That happens due to patient volume. So that information allows us to identify a practice issue. And then from there, we can work together to see at what point these patients are leaving and how we can stop that, or also how we can use that information to improve our efficiency so they don't feel like they need to leave. They can also use this to reallocate resources. So if we're having a few days where we're very busy, we're over our daily patient census, they can take a look at that and go to upper management and say, we are consistently at this percent overage of our daily patient expected, and we need additional support to provide safe and effective care. Artificial intelligence is not new, but it is newer than some other technology in the field of informatics. It started around 2014. It's got the ability to quickly synthesize data that's collected and can really help providers aid in decision making by helping identify things in their differential diagnosis that they maybe hadn't previously considered. It's important to note, though, that anytime you're using technology like this, it's not meant to replace the provider or the nurse or any staff that's working at the bedside who has the ability to lay eyes on the patient. And while it is a tool to help with diagnosis, it shouldn't be the sole factor. It should remain a tool. Because this program requires increased data sharing, it's really important that we understand how that data is being used so we can convey that back to our patients. The next generation of nurses are gonna need some help. We should be tailoring curriculum to prepare them for use of things like artificial intelligence and electronic health records and data management software. This can be difficult because schools are seeing all of these big changes and they may have a hard time defining what is relevant to include in curriculum and what really isn't. Something that I noticed in my research was the American Nurse Association has some really great standards on information literacy, health information literacy, and they would be a great resource to kind of help define what is determined proficient and what standards of care should be. That way we can use that to tailor the education for our students. It's also important to understand from a population health standpoint that telehealth and other informatics tools can help address inequities. Teaching about social determinants of health is something that occurs, but maybe not as effectively as it should be. This is an easy way for us to gather data and say, look at these trends, look at how these disadvantaged groups are getting care or not getting care, and how can we use the technology that we have to improve that. We've seen a rise in telehealth visits with COVID, and a kind of unintended consequence of this that's not really a bad thing is people who could not normally get to their provider easily have the ability to do so through telehealth. That being said, technology and equipment has a cost to it. So there are going to be other disparities that arise from this. And these are all things that we should be aware of. Moving over to ethical implications, there's a lot of sensitive health data that's collected in health records and data management software and AI systems. Basically, all of this is at a potential for security breaches. It's important for patients to be educated on how their data is being protected and what data is being used. This is kind of part of the informed consent process. We don't necessarily think about that when we are documenting these things into an electronic health record, but any patient who's new to our system and new to our technology should be educated on how that information is going to be used. That way they can make a meaningful decision if that's something they're comfortable with prior to receiving care. And while this is not always possible in emergent situations where a patient is unstable, it's still something that we should consider whenever we can. Another ethical implication we've kind of already touched on is that these are tools. They are not meant to replace a provider or a nurse or their ability to do their job that they have been trained to do. They are susceptible to error, and because of that, we should be evaluating all of the recommendations it makes, and we should be asking, do these make sense with what I'm seeing as a provider? So, something that I found very interesting that I'd like to share with you is the way that informatics is improving education. Adaptive learning is something that we've maybe seen before, but didn't really know that's what was going on. An example of this is anybody who's done an ACLS, BLS, or PALS certification through the American Heart Association. If you're using their online platform that uses adaptive learning to determine where you're at with your knowledge and it supports you at the level you're on, that way you're not getting excess instruction that may be boring or may cause you to lose interest or drive to continue, but you are getting what you need to fill gaps in your knowledge. The nice thing about this is it can provide students with real-time feedback. So a classroom with 30 students and one professor, that one professor has to review all of these assessments and they have to give feedback to students to help them know if they are or aren't on track. With adaptive learning platforms, as you go through the questions, it gives you that feedback of, well, you didn't quite get it, but this is why. And so when you go through that next time, you can apply that and you can use that to increase your understanding. Another really great benefit is the ability for instructors to examine the areas that students are doing well on. If you have a class of 30 people and 17 of them are doing poorly on this one topic, then you know that this is something we need to circle back to. We need to do additional activities, or we need to talk about it a little bit more and help students increase their comfort. Again, this is just a tool to help instructors bridge gaps. It's not meant to replace them. So that is a really critical thing that it can be used for by instructors. Another really great unintended benefit is having students work with technology like this is helping them build some comfort with it. And so it's a good opportunity to increase their knowledge while also building comfort that they're going to need in the future. Informatics has a very critical role in guiding research. The main way that we can see this is with data trends that are showing practice gaps. If you are doing the same procedure day in and day out, but when you look at your data, you're seeing higher infection rates or a greater incidence of readmissions or a greater incidence of noncompliance, we can easily pull that data and look at it and say, well, we're seeing higher infections because we stopped doing this in our process, or we're seeing higher readmission rates because we're not providing patients with the information they need to be successful outside of care settings. It also has a really beneficial ability to help us understand the scope of a problem when we are doing research. That way we can tell if it is a department problem, a hospital problem, or an organizational problem that requires a greater amount of people to be involved to get to the bottom of it and implement new strategies. as we begin to implement new strategies, data management software can tell us if we're meeting our mark or if there is more that needs to be done. This can also tell us if maybe what we're implementing is not beneficial and it is causing unintended issues so that we can go back to previous policies and better examine what we need to do to move forward. There's several impacts of new government regulation. A really great resource I found was the Office of the Assistant Secretary for Technology Policy. They have information about things like the 21st Century CARES Act and the High Tech Act. Both of these seek to improve safety for patients in technology while also understanding that we need to continue our research into technology and find out in what ways you can advance. That being said, advancing does have a amount of risk to it, no matter what you're doing. So these policies have created a structure that can be used to kind of mitigate risk and help with healthy risk taking. So it's a great resource, and I do recommend checking out their website. That's going to be it for me. These are my references, and if you have any questions, please feel free to reach out to me by email. I hope you have a great day.